Hi, everyone. This is Nurse Anna from nursestudy.net, and today we're going to be doing Fundamentals of Nursing. We have 75 questions. Enjoy. And if you would like one of our free audiobooks with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 72-year-old female patient with a history of chronic obstructive pulmonary disease, COPD, is admitted with acute shortness of breath and confusion. Her oxygen saturation is 88% on room air, and her arterial blood gas, ABG, results show pH 7.30, PaCO2 60 mm of mercury, and HCO3 26 milliequivalent per liter. What is the nurse's priority intervention? A. Administer high-flow oxygen at 10 liters per minute via a non-rebreather mask. B. Initiate BiPAP therapy as prescribed. C. Encourage deep breathing and coughing exercises. D. Administer an IV bolus of sodium bicarbonate. Correct answer, B. Rationale: the patient is in respiratory acidosis due to CO2 retention from COPD exacerbation. BiPAP, bilevel positive airway pressure, helps improve ventilation by reducing CO2 levels and preventing the need for intubation. High-flow oxygen, A, can worsen CO2 retention in COPD patients. Deep breathing and coughing, C, may help but are not the priority in acute respiratory failure. Sodium bicarbonate, D, is not appropriate for respiratory acidosis as it does not address the underlying cause. Question 2. A post-operative patient who underwent abdominal surgery 12 hours ago is experiencing increasing abdominal distension, absent bowel sounds, and a heart rate of 110. The nurse suspects paralytic ileus. Which action should the nurse take first? A. Insert a nasogastric tube, NGT, to low intermittent suction as prescribed. B. Administer IV metoclopramide, Reglan, to stimulate peristalsis. C. Encourage the patient to ambulate in the hallway. D. Provide sips of clear liquids to assess tolerance. Correct answer, A. Rationale: the patient is showing signs of paralytic ileus, a postoperative complication where the intestines stop moving. An NGT to suction will decompress the stomach and relieve symptoms. Metoclopramide, B, is contraindicated because it stimulates gastric emptying but does not resolve an ileus. Ambulation, C, is beneficial but not the priority. Oral intake, D, is contraindicated due to absent bowel sounds. Question 3. A 56-year-old male patient with type 2 diabetes mellitus is admitted with cellulitis of the right foot. His blood glucose is 320 mg per deciliter, and his temperature is 101.2 degrees Fahrenheit 38.4 degrees Celsius. What is the nurse's best intervention? A. Apply warm compresses to the affected foot. B. Encourage oral hydration to flush out the infection. C. Administer IV antibiotics as prescribed. D. Instruct the patient to keep the foot elevated at all times. Correct answer, C. Rationale: the priority intervention for cellulitis in a diabetic patient is prompt IV antibiotic therapy to prevent sepsis and osteomyelitis. Warm compresses, A, may be used but are not the priority. Oral hydration, B, is important but not the primary treatment. Elevation, D, may reduce swelling but does not treat the infection. Question 4. A patient receiving a blood transfusion begins experiencing chills, fever, and flank pain 10 minutes after the transfusion starts. What is the first action the nurse should take? A. Stop the transfusion immediately. B. Slow the infusion rate and monitor vital signs. C. Administer acetaminophen for fever. D. Flush the IV line with normal saline and continue the transfusion. Correct answer, A. Rationale: the patient is experiencing an acute hemolytic reaction, a life-threatening transfusion reaction. The priority is to stop the transfusion immediately to prevent further hemolysis. Slowing the rate, B, or flushing with saline, D, does not stop the reaction. Acetaminophen, C, does not address the underlying cause. Question 5. A nurse is caring for a patient with heart failure who has gained 4 kilograms, 8.8 pounds, over the past 3 days. Which assessment finding requires immediate intervention? A. Bilateral pitting edema in the lower extremities. B. Crackles heard in both lung bases. C. Blood pressure of 140 over 85 millimeters of mercury. D. Urine output of 40 milliliters per hour. Correct answer, B. Rationale: crackles indicate pulmonary edema, a sign of worsening heart failure that requires urgent intervention, such as diuretics and oxygen therapy. Edema, A, is expected but not immediately life-threatening. BP of 140 over 85 millimeters of mercury, C, is elevated but not critical. Urine output of 40 milliliters per hour, D, is within the normal range. Question 6. A 68-year-old female patient with osteoporosis presents with severe lower back pain after lifting a heavy object. Which diagnostic test should the nurse anticipate the provider ordering first? A. Bone density scan, DEXA. B. Lumbar X-ray. C. MRI of the spine. D. Serum calcium and vitamin D levels. Correct answer, B. Rationale: a lumbar X-ray is the initial test to assess for vertebral compression fractures. A DEXA scan, A, evaluates bone density but does not diagnose fractures. MRI, C, may be used for soft tissue injuries but is not the first-line test. Calcium and vitamin D levels, D, assess bone metabolism but do not diagnose fractures. Question 7. A nurse is caring for a patient with a potassium level of 2.9 milliequivalent per liter. Which ECG change is most concerning? A. Peaked T waves. B. Widened QRS complex. C. Prominent U waves. D. Sinus tachycardia. Correct answer, C. Rationale: hypokalemia, potassium less than 3.5 milliequivalent per liter, causes prominent U waves on ECG. Peaked T waves, A, and widened QRS, B, indicate hyperkalemia. Sinus tachycardia, D, may occur but is not the hallmark sign. Question 8. A nurse is monitoring a patient on continuous heparin therapy for a deep vein thrombosis, DVT. Which finding requires immediate action? A. Activated partial thromboplastin time, APTT, of 65 seconds. B. Hemoglobin level of 8.5 grams per deciliter. C. Platelet count of 90,000. D. Presence of new petechiae and bruising. Correct answer, D. Rationale: petechiae and bruising suggest heparin-induced thrombocytopenia, HIT, a life-threatening condition. APTT of 65 seconds, A, is within therapeutic range. Hemoglobin of 8.5 grams per deciliter, B, is low but not an immediate emergency. Platelet count of 90,000, C, is concerning but does not require immediate intervention unless symptoms appear. Question 9. A patient with cirrhosis is admitted with worsening ascites and confusion. The nurse recognizes the patient may be experiencing which complication? A. Acute kidney injury. B. Hepatic encephalopathy. C. Esophageal varices. D. Portal hypertension. Correct answer, B. Rationale: confusion and ascites suggest hepatic encephalopathy, caused by ammonia buildup. Acute kidney injury, A, and esophageal varices, C, may occur in cirrhosis, but do not directly explain the confusion. Portal hypertension, D, leads to ascites but not altered mental status. Question 10. A patient with an indwelling urinary catheter develops a fever, suprapubic pain, and cloudy urine. What is the nurse's priority action? A. Remove the catheter and obtain a urine culture. B. Administer acetaminophen for fever. C. Encourage increased oral fluid intake. D. Flush the catheter with sterile normal saline. Correct answer, A. Rationale: the patient likely has a catheter-associated UTI, CAUTI. The priority is to remove the catheter and obtain a urine culture to determine the causative organism. Acetaminophen, B, and fluids, C, are supportive but not the priority. Flushing, D, can introduce more bacteria. Question 11. A 79-year-old patient with a history of atrial fibrillation is prescribed warfarin. The nurse reviews the patient's INR, which is 5.6. What is the nurse's priority action? A. Administer vitamin K as prescribed. B. Continue administering warfarin as scheduled. C. Encourage increased intake of leafy green vegetables. D. Monitor for signs of deep vein thrombosis, DVT. Correct answer, A. Rationale: an INR of 5.6 is critically high, increasing the risk of severe bleeding. Vitamin K is the antidote to reverse warfarin's effects. Continuing warfarin, B, is inappropriate. Leafy greens, C, contain vitamin K, but dietary changes take time. DVT monitoring, D, is not relevant since the patient is at risk for bleeding, not clotting. Question 12. A nurse is assessing a patient with a nasogastric NG tube on continuous suction who reports muscle cramps and weakness. The nurse notes a heart rate of 52 and flattened T waves on the ECG. What is the most likely electrolyte imbalance? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypernatremia. Correct answer, B. Rationale: hypokalemia, potassium less than 3.5 milliequivalent per liter, occurs due to gastric losses from NG suction. Symptoms include muscle cramps, bradycardia, and flattened T waves. Hyperkalemia, A, causes peaked T waves. Hypercalcemia, C, causes weakness and kidney stones. Hypernatremia, D, leads to altered mental status. Question 13. A nurse is caring for a patient who just had a total hip replacement. Which finding requires immediate intervention? A. Hemoglobin of 11.8 grams per deciliter. B. Moderate bruising around the surgical site. C. Right leg externally rotated and shorter than the left. D. Pain level of 6 out of 10, despite analgesia. Correct answer, C. Rationale: external rotation and limb shortening suggest a hip dislocation, a surgical emergency. Mild anemia, A, is common postoperatively. Bruising, B, is expected. Pain, D, requires management but does not indicate an emergency. Question 14. A patient with a chest tube following a pneumothorax has continuous bubbling in the water seal chamber. What is the nurse's priority action? A. Clamp the chest tube immediately. B. Encourage the patient to cough and deep breathe. C. Check the tubing and connections for an air leak. D. Increase the suction pressure to -40 cm H2O. Correct answer, C. Rationale: continuous bubbling in the water seal chamber suggests an air leak in the system, requiring an assessment of tubing and connections. Clamping the chest tube, A, can cause a tension pneumothorax. Coughing and deep breathing, B, do not resolve a leak. Increasing suction, D, will not correct the problem. Question 15. A nurse is preparing to administer digoxin to a patient with heart failure. The patient reports nausea, dizziness, and seeing yellow halos around lights. What is the nurse's best action? A. Administer the medication and reassess in 1 hour. B. Check the patient's potassium level. C. Hold the medication and notify the provider. D. Encourage the patient to drink a glass of water with the medication. Correct answer, C. Rationale: nausea, dizziness, and yellow halos are signs of digoxin toxicity. The nurse should hold the medication and notify the provider. Checking potassium, B, is important but does not address the immediate concern. Administering digoxin, A, D, could worsen toxicity. Question 16. A patient receiving total parenteral nutrition, TPN, suddenly develops confusion, diaphoresis, and tachycardia. What is the nurse's priority intervention? A. Stop the TPN infusion immediately. B. Administer IV dextrose as prescribed. C. Monitor capillary blood glucose levels. D. Notify the healthcare provider. Correct answer, B. Rationale: sudden confusion, sweating, and tachycardia suggest hypoglycemia, a common complication of abrupt discontinuation of TPN. The priority is to administer IV dextrose to prevent further glucose depletion. Stopping TPN, A, worsens the issue. Monitoring glucose, C, is important but not the priority action. Notifying the provider, D, should follow intervention. Question 17. A nurse is caring for a patient with a new tracheostomy who has a sudden onset of respiratory distress, decreased oxygen saturation, and absent breath sounds on one side. What is the most likely cause? A. Mucus plug. B. Pneumothorax. C. Accidental decannulation. D. Tracheal stenosis. Correct answer, B. Rationale: absent breath sounds and respiratory distress suggest a pneumothorax, a possible complication of tracheostomy placement. A mucus plug, A, causes increased resistance but not absent breath sounds. Decannulation, C, results in stridor. Tracheal stenosis, D, develops over time. Question 18. A patient with acute pancreatitis reports severe abdominal pain radiating to the back. The nurse notes Gray Turner's sign, bruising on the flanks. What is the nurse's best action? A. Obtain a stat serum lipase level. B. Administer IV morphine as prescribed. C. Initiate NPO status and start IV fluids. D. Place the patient in a high Fowler's position. Correct answer, C. Rationale: Gray Turner's sign indicates retroperitoneal hemorrhage, a severe complication of pancreatitis. NPO status and IV fluids prevent further pancreatic stimulation. Lipase testing, A, is diagnostic but not the priority. Morphine, B, manages pain but does not address the underlying issue. High Fowler's position, D, does not improve outcomes. Question 19. A patient with a history of liver cirrhosis presents with new-onset confusion, asterixis, and lethargy. What laboratory finding should the nurse anticipate? A. Elevated ammonia levels. B. Decreased albumin levels. C. Elevated bilirubin levels. D. Increased prothrombin time, PT. Correct answer, A. Rationale: confusion and asterixis indicate hepatic encephalopathy, caused by elevated ammonia levels. Low albumin, B, high bilirubin, C, and prolonged PT, D, occur in liver disease but do not specifically indicate encephalopathy. Question 20. A nurse is assessing a patient receiving IV vancomycin. The patient develops flushing, hypotension, and pruritus. What is the nurse's priority intervention? A. Discontinue the IV infusion immediately. B. Slow the infusion rate and monitor closely. C. Administer epinephrine as prescribed. D. Notify the provider of an allergic reaction. Correct answer, B. Rationale: the patient is experiencing red man syndrome, a reaction to rapid vancomycin infusion. Slowing the infusion, B, can prevent further symptoms. Discontinuing the infusion, A, is not necessary unless anaphylaxis occurs. Epinephrine, C, is used for anaphylaxis, not red man syndrome. Notifying the provider, D, is important but not the priority action. Question 21. A patient is receiving intravenous furosemide for acute heart failure. The nurse notes the patient has a potassium level of 2.8 milliequivalent per liter and reports leg cramps. What is the nurse's priority action? A. Administer IV potassium as prescribed. B. Hold the next dose of furosemide. C. Encourage the patient to eat potassium-rich foods. D. Monitor for widened QRS complexes on ECG. Correct answer, A. Rationale: hypokalemia, potassium less than 3.5 milliequivalent per liter, is a common side effect of furosemide. IV potassium administration is the priority to prevent cardiac arrhythmias. Holding furosemide, B, may be necessary but is not the immediate priority. Dietary potassium, C, takes time to correct levels. Monitoring ECG changes, D, is important but does not treat the cause. Question 22. A nurse is caring for a patient with syndrome of inappropriate antidiuretic hormone, SIADH. Which assessment finding requires immediate intervention? A. Serum sodium of 120 milliequivalent per liter. B. Urine specific gravity of 1.030. C. 2+ pitting edema in the lower extremities. D. Blood pressure of 138/86 millimeters of mercury. Correct answer, A. Rationale: severe hyponatremia, sodium less than 125 milliequivalent per liter, in SIADH can lead to seizures and coma, requiring urgent correction with hypertonic saline. High urine-specific gravity, B, is expected in SIADH. Edema, C, and slightly elevated BP, D, are less concerning than critical hyponatremia. Question 23. A patient with a new colostomy reports excessive gas and a distended abdomen. What dietary advice should the nurse provide? A. Increase fiber intake with raw vegetables. B. Drink carbonated beverages to aid digestion. C. Avoid foods like cabbage, beans, and onions. D. Reduce protein intake to minimize odor. Correct answer, C. Rationale: certain foods, cabbage, beans, onions, produce excessive gas in colostomy patients. High fiber, A, should be introduced gradually. Carbonated beverages, B, increase bloating. Protein reduction, D, is unnecessary, though odor control measures, charcoal filters, can help. Question 24. A nurse is caring for a patient receiving total parenteral nutrition, TPN. The bag is empty, and no replacement is available. What is the nurse's best action? A. Infuse dextrose 10% in water, D10W, until new TPN is available. B. Stop the IV infusion and flush the line with saline. C. Hang normal saline, 0.9%, temporarily. D. Increase oral carbohydrate intake. Correct answer, A. Rationale: sudden TPN discontinuation can cause hypoglycemia. D10W maintains glucose levels until new TPN is available. Flushing the line, B, and hanging normal saline, C, do not prevent hypoglycemia. Oral intake, D, is not an option for patients dependent on TPN. Question 25. A patient with a history of deep vein thrombosis, DVT, is prescribed enoxaparin, Lovenox. Which statement by the patient requires further teaching? A. I will inject this medication into my abdomen. B. I need to have my INR checked regularly. C. I should not massage the injection site. D. I will avoid taking aspirin or ibuprofen. Correct answer, B. Rationale: enoxaparin, Lovenox, is a low molecular weight heparin, LMWH, that does not require INR monitoring, unlike warfarin. Abdominal injection, A, is correct. Avoiding massage, C, prevents bruising. Avoiding NSAIDs, D, reduces bleeding risk. Question 26. A nurse is preparing to administer an intermittent enteral feeding via a nasogastric (NG) tube. Which assessment finding requires intervention before initiating the feeding? A. Gastric residual of 100 milliliters. B. Head of the bed at 15 degrees. C. Presence of active bowel sounds. D. pH of 3 from gastric aspirate. Correct answer, B. Rationale: the head of the bed should be at least 30 to 45 degrees to prevent aspiration. Gastric residual of 100 milliliters, A, is within normal limits. Bowel sounds, C, confirm intestinal function. pH of 3, D, confirms correct NG tube placement in the stomach. Question 27. A patient with a history of chronic kidney disease, CKD, reports tingling in the fingers, muscle cramps, and a positive Chvostek sign. What electrolyte imbalance does the nurse suspect? A. Hyperkalemia. B. Hypocalcemia. C. Hyperphosphatemia. D. Hypermagnesemia. Correct answer, B. Rationale: hypocalcemia in CKD occurs due to impaired vitamin D activation. Symptoms include tetany, Chvostek's sign, facial twitching, and muscle cramps. Hyperkalemia, A, causes cardiac arrhythmias. Hyperphosphatemia, C, occurs in CKD but does not cause Chvostek's sign. Hypermagnesemia, D, causes lethargy and hypotension. Question 28. A nurse is caring for a patient with cirrhosis and ascites. Which nursing intervention is most appropriate? A. Restrict sodium and encourage fluid intake. B. Administer IV albumin followed by furosemide. C. Encourage bed rest to prevent fluid shifts. D. Position the patient flat to enhance venous return. Correct answer, B. Rationale: albumin helps pull fluid into the vascular space, followed by furosemide to remove excess fluid. Sodium should be restricted, A, but fluid intake is typically restricted, not encouraged. Bed rest, C, is not necessary. Lying flat, D, can worsen breathing difficulties due to ascites. Question 29. A patient receiving IV vancomycin develops flushing, pruritus, and hypotension. What is the nurse's best action? A. Stop the infusion and notify the provider. B. Slow the infusion rate and monitor vital signs. C. Administer diphenhydramine and continue infusion. D. Discontinue vancomycin and document an allergic reaction. Correct answer, A. Rationale: red man syndrome is a reaction to rapid vancomycin infusion. The priority is to stop the infusion immediately, notify the provider, and consider antihistamines if needed. Slowing the rate, B, is used for prevention but is not appropriate once symptoms occur. Continuing the infusion, C, D, is incorrect as red man syndrome is not a true allergy but a rate-related reaction. Question 30. A nurse is caring for a patient with severe burns who develops new-onset confusion, oliguria, and a serum potassium of 6.5 milliequivalent per liter. What complication does the nurse suspect? A. Sepsis. B. Hypovolemic shock. C. Acute kidney injury. D. Fluid volume deficit. Correct answer, C. Rationale: severe burns can lead to acute kidney injury, AKI, due to hypoperfusion and myoglobin release. Hyperkalemia, potassium greater than 5.5 milliequivalent per liter, and oliguria indicate renal failure. Sepsis, A, can occur but does not explain hyperkalemia. Hypovolemic shock, B, D, causes tachycardia and hypotension but does not primarily cause hyperkalemia. Question 31. A patient receiving mechanical ventilation suddenly develops a high-pressure alarm. The nurse assesses the patient and notes decreased breath sounds on the right side, tachycardia, and tracheal deviation to the left. What is the nurse's priority action? A. Increase the ventilator's tidal volume. B. Prepare for emergency needle decompression. C. Reposition the patient to improve lung expansion. D. Check the ventilator tubing for kinks or blockages. Correct answer, B. Rationale: tracheal deviation, tachycardia, and absent breath sounds suggest a tension pneumothorax, requiring emergency needle decompression. Increasing tidal volume, A, would worsen the pneumothorax. Repositioning, C, does not resolve the issue. Checking tubing, D, is necessary for other high-pressure alarm causes, but not in this emergency. Question 32. A nurse is caring for a patient with myasthenia gravis who develops respiratory distress and difficulty speaking. What is the nurse's best action? A. Prepare for endotracheal intubation. B. Administer an additional dose of pyridostigmine. C. Assist the patient to a high Fowler's position. D. Encourage the patient to rest and conserve energy. Correct answer, A. Rationale: respiratory distress and myasthenia gravis may indicate myasthenic crisis, requiring intubation. Pyridostigmine, B, is helpful, but not appropriate in acute respiratory failure. High Fowler's position, C, can help, but it does not resolve the crisis. Rest, D, is important but not a priority in this situation. Question 33. A patient with end-stage renal disease, ESRD, who receives hemodialysis 3 times a week is admitted with confusion and headache. The nurse notes blood pressure of 190 over 110 millimeters of mercury and a serum BUN of 98 milligrams per deciliter. What complication does the nurse suspect? A. Hyperkalemia. B. Dialysis disequilibrium syndrome. C. Fluid volume deficit. D. Hypertensive crisis. Correct answer, B. Rationale: dialysis disequilibrium syndrome occurs when fluid and urea are removed too quickly, leading to cerebral edema. Hyperkalemia, A, causes arrhythmias, not confusion. Fluid deficit, C, would present with hypotension, not hypertension. Hypertensive crisis, D, is possible, but does not explain the BUN elevation. Question 34. A nurse is administering IV potassium chloride to a patient with hypokalemia. The patient reports burning at the infusion site. What is the nurse's best action? A. Increase the IV infusion rate to correct hypokalemia faster. B. Stop the infusion and notify the provider. C. Apply a warm compress and slow the infusion rate. D. Administer lidocaine before resuming the infusion. Correct answer, C. Rationale: potassium chloride infusions are irritating to veins, so applying a warm compress and slowing the infusion can help. Increasing the rate, A, is unsafe. Stopping the infusion, B, is not necessary unless infiltration occurs. Lidocaine, D, is not typically used in IV potassium administration. Question 35. A patient with a recent stroke is experiencing dysphagia. Which nursing intervention is most appropriate to reduce the risk of aspiration? A. Offer thin liquids with meals. B. Encourage the patient to tuck their chin while swallowing. C. Instruct the patient to use a straw for drinking. D. Position the patient in a supine position after meals. Correct answer, B. Rationale: chin tuck maneuver helps prevent aspiration by reducing airway opening during swallowing. Thin liquids, A, increase aspiration risk, thickened liquids are preferred. Using a straw, C, is unsafe for dysphagia patients. Lying supine, D, increases aspiration risk. Question 36. A nurse is assessing a postoperative patient who received general anesthesia. The patient's respiratory rate is 8 breaths per minute, and their oxygen saturation is 89%. What is the nurse's priority intervention? A. Administer naloxone as prescribed. B. Encourage deep breathing and coughing. C. Increase oxygen flow rate. D. Assess the patient's pain level. Correct answer, A. Rationale: the patient likely has opioid-induced respiratory depression due to anesthesia, requiring naloxone to reverse the effects. Deep breathing, B, and increasing oxygen, C, do not address the cause. Assessing pain, D, is secondary to stabilizing breathing. Question 37. A patient with sepsis is receiving norepinephrine via a central line. The nurse notices blanching and coolness around the IV site. What is the nurse's best action? A. Discontinue the IV infusion immediately. B. Administer phentolamine as prescribed. C. Elevate the affected limb above heart level. D. Apply a warm compress to the area. Correct answer, B. Rationale: blanching and coolness suggest norepinephrine extravasation, which can cause necrosis. Phentolamine, an antidote, is needed to prevent tissue damage. Stopping the IV, A, may worsen ischemia if the antidote is not given first. Elevation, C, and warm compresses, D, do not reverse the effects of extravasation. Question 38. A nurse is preparing to administer morning medications to a patient with Parkinson's disease. The patient is experiencing severe tremors and difficulty swallowing. What is the nurse's best action? A. Crush all oral medications and mix them with applesauce. B. Hold the medications and notify the provider. C. Administer carbidopa-levodopa first and reassess swallowing ability. D. Encourage the patient to take small sips of water before each pill. Correct answer, C. Rationale: carbidopa-levodopa improves motor function, helping the patient regain swallowing ability. Crushing all medications, A, may not be safe for extended-release pills. Holding medications, B, could worsen symptoms. Sips of water, D, help but do not address the underlying motor impairment. Question 39. A nurse is caring for a patient on a heparin infusion for a pulmonary embolism. The patient's platelet count drops from 230,000 to 90,000 in 24 hours. What is the nurse's priority action? A. Discontinue the heparin infusion immediately. B. Slow the infusion rate and monitor platelets closely. C. Administer protamine sulfate as prescribed. D. Notify the provider and prepare to administer warfarin. Correct answer, A. Rationale: a rapid drop in platelets suggests heparin-induced thrombocytopenia, HIT, requiring immediate discontinuation of heparin. Slowing the rate, B, does not prevent HIT. Protamine sulfate, C, reverses heparin's effects but does not treat HIT. Warfarin, D, should not be started until HIT is resolved. Question 40. A patient with a traumatic brain injury has a Glasgow Coma Scale, GCS, score of 6. What is the nurse's priority intervention? A. Place the patient in a side-lying position. B. Prepare for immediate intubation. C. Perform a sternal rub to stimulate the patient. D. Notify the provider and document the findings. Correct answer, B. Rationale: a GCS score of 6 indicates severe brain injury, requiring intubation to protect the airway. Side-lying position, A, prevents aspiration but does not secure the airway. Sternal rub, C, is not a treatment. Notifying the provider, D, is necessary but secondary to airway management. Question 41. A patient with a C6 spinal cord injury reports a sudden severe headache, flushed skin, and a blood pressure of 210/110 millimeters of mercury. What is the nurse's priority intervention? A. Administer IV labetalol as prescribed. B. Elevate the head of the bed to 90 degrees. C. Check for a distended bladder or bowel impaction. D. Call the healthcare provider immediately. Correct answer, C. Rationale: the patient is experiencing autonomic dysreflexia, a life-threatening complication of spinal cord injury. Bladder distension or fecal impaction is the most common cause, so the nurse should assess and relieve the trigger. Elevating the head of the bed, B, helps lower blood pressure but does not address the cause. IV antihypertensives, A, may be used if non-pharmacological measures fail. Notifying the provider, D, is necessary but not the first action. Question 42. A nurse is administering morning insulin to a patient with type 1 diabetes. The patient is scheduled for surgery in 1 hour and has been NPO since midnight. What is the nurse's best action? A. Administer the full dose of insulin as prescribed. B. Hold the insulin dose and monitor blood glucose levels. C. Give half the prescribed insulin dose. D. Administer the insulin with IV dextrose. Correct answer, B. Rationale: patients who are NPO before surgery are at risk for hypoglycemia if insulin is given. The nurse should hold insulin and monitor blood glucose closely. Administering a full dose, A, can cause severe hypoglycemia. Giving half a dose, C, is inappropriate without provider guidance. IV dextrose, D, is not routinely given unless hypoglycemia occurs. Question 43. A nurse is caring for a patient with severe burns who has a urine output of 15 milliliters per hour, a heart rate of 128, and a blood pressure of 88/56 millimeters of mercury. What is the nurse's priority intervention? A. Administer IV morphine for pain. B. Increase IV fluid infusion rate as prescribed. C. Elevate the lower extremities. D. Apply additional dressings to burned areas. Correct answer, B. Rationale: hypovolemic shock is a major concern in burn patients due to massive fluid shifts. Increasing IV fluids restores perfusion and prevents organ failure. Pain control, A, is important but not the priority over fluid resuscitation. Elevating extremities, C, may help but is not the first action. Applying dressings, D, does not address hypovolemia. Question 44. A patient receiving IV gentamicin for a severe infection reports ringing in the ears. What is the nurse's best action? A. Administer the next dose and reassure the patient. B. Hold the medication and notify the provider. C. Encourage increased oral fluid intake. D. Monitor the patient's blood pressure and heart rate. Correct answer, B. Rationale: gentamicin is an ototoxic medication, and ringing in the ears, tinnitus, is an early sign of toxicity. The nurse should hold the medication and notify the provider to prevent irreversible hearing loss. Continuing the drug, A, could worsen toxicity. Fluids, C, do not prevent ototoxicity. Vital signs, D, do not assess hearing loss. Question 45. A nurse is preparing to administer an intramuscular, IM, injection to a 6-month-old infant. Which site is most appropriate? A. Deltoid. B. Ventrogluteal. C. Vastus lateralis. D. Dorsogluteal. Correct answer, C. Rationale: the vastus lateralis is the preferred IM injection site for infants, because it has well-developed muscle mass and lacks major nerves or blood vessels. Deltoid, A, is too small in infants. Ventrogluteal, B, is used in older children and adults. Dorsogluteal, D, is no longer recommended due to risk of sciatic nerve injury. Question 46. A patient receiving enalapril for hypertension reports swelling of the lips and difficulty breathing. What is the nurse's priority intervention? A. Administer diphenhydramine and reassess. B. Stop the medication and call the provider. C. Prepare for emergency intubation. D. Encourage the patient to drink cold fluids. Correct answer, C. Rationale: angioedema is a life-threatening adverse effect of ACE inhibitors, e.g., enalapril, that can lead to airway obstruction. The priority is to secure the airway. Stopping the medication, B, is necessary but does not address the emergency. Diphenhydramine, A, may not be effective. Cold fluids, D, will not prevent airway swelling. Question 47. A patient receiving chemotherapy has a white blood cell, WBC, count of 1,500. What is the most important nursing intervention? A. Administer PRN acetaminophen for fever. B. Place the patient in a private room with neutropenic precautions. C. Encourage increased protein intake. D. Withhold the next chemotherapy dose. Correct answer, B. Rationale: a WBC count of 1,500 indicates neutropenia, placing the patient at high risk for infection. Neutropenic precautions, including a private room and strict hand hygiene, are necessary. Fever, A, is an emergency in neutropenic patients. Dietary changes, C, support immunity but do not prevent infection. Holding chemotherapy, D, requires provider approval. Question 48. A patient with Addison's disease is admitted with nausea, vomiting, confusion, and a blood pressure of 80/50 mm of mercury. What is the nurse's priority intervention? A. Administer IV normal saline and hydrocortisone. B. Encourage oral sodium intake. C. Monitor blood glucose levels every 4 hours. D. Provide emotional support to reduce stress. Correct answer, A. Rationale: the patient is experiencing an Addisonian crisis, a life-threatening emergency requiring IV fluids and corticosteroids to restore hemodynamic stability. Oral sodium, B, is not appropriate in crisis. Glucose monitoring, C, is secondary. Emotional support, D, is helpful, but not the priority. Question 49. A nurse is assessing a patient who received epidural anesthesia during labor. The patient's blood pressure is 82/48 millimeters of mercury, and she reports feeling dizzy. What is the nurse's priority action? A. Increase IV fluids as prescribed. B. Position the patient flat with legs elevated. C. Administer oxygen via face mask. D. Stop the epidural infusion immediately. Correct answer, B. Rationale: hypotension is a common side effect of epidural anesthesia, and positioning the patient flat with legs elevated improves venous return. IV fluids, A, help but are not the first action. Oxygen, C, may be needed but does not address the cause. Stopping the epidural, D, is not necessary unless severe symptoms persist. Question 50. A nurse is teaching a patient with a new ileostomy about dietary modifications. Which statement indicates the patient needs further teaching? A. I should drink at least 2 to 3 liters of fluid daily. B. I need to avoid high-fiber foods like popcorn and nuts. C. I should expect my stool to be liquid and frequent. D. I can take laxatives if I don't have a bowel movement for a day. Correct answer, D. Rationale: laxatives should be avoided in ileostomy patients because they can lead to dehydration and electrolyte imbalances. Adequate hydration, A, is essential. Avoiding high-fiber foods, B, prevents obstruction. Liquid stool, C, is expected. Question 51. A patient with a history of chronic atrial fibrillation is scheduled for a cardioversion. Which nursing action is most important before the procedure? A. Administer atropine as prescribed. B. Ensure the patient has been on anticoagulation therapy. C. Position the patient in a left lateral position. D. Instruct the patient to be NPO for 8 hours. Correct answer, B. Rationale: patients with chronic atrial fibrillation are at high risk for thromboembolism. Anticoagulation therapy is required before cardioversion to prevent clot dislodgement. Atropine, A, is used for bradycardia, not AFib. Positioning, C, is not relevant. NPO status, D, is required for sedation but is not the priority over anticoagulation. Question 52. A patient receiving vancomycin IV develops flushing, hypotension, and itching 10 minutes into the infusion. What is the nurse's priority action? A. Stop the infusion immediately and call the provider. B. Slow the infusion rate and monitor the patient. C. Administer diphenhydramine and continue the infusion. D. Elevate the patient's legs to improve blood pressure. Correct answer, A. Rationale: the patient is experiencing red man syndrome, a histamine-mediated reaction to rapid vancomycin infusion. Stopping the infusion immediately prevents further reaction. After stopping, the provider should be notified, and antihistamines like diphenhydramine may be given. Slowing the infusion, B, is incorrect because the reaction is already occurring. Continuing the infusion with diphenhydramine, C, does not address the reaction's cause. Leg elevation, D, does not resolve the issue. Question 53. A patient with Guillain-Barré syndrome has a respiratory rate of 10 breaths per minute and weak cough effort. What is the nurse's priority intervention? A. Administer IV corticosteroids. B. Prepare for mechanical ventilation. C. Place the patient in a high Fowler's position. D. Assess deep tendon reflexes. Correct answer, B. Rationale: Guillain-Barré syndrome can cause ascending paralysis, leading to respiratory failure. Mechanical ventilation is needed if respiratory muscles weaken. Corticosteroids, A, are not first-line treatment. Positioning, C, helps but is not sufficient. Deep tendon reflex assessment, D, does not address respiratory failure. Question 54. A nurse is monitoring a patient with diabetic ketoacidosis, DKA. Which laboratory finding indicates the most urgent need for intervention? A. Blood glucose of 320 mg per deciliter. B. Serum potassium of 2.9 milliequivalent per liter. C. Arterial pH of 7.28. D. Urine ketones positive. Correct answer, B. Rationale: hypokalemia, potassium less than 3.5 milliequivalent per liter, is a life-threatening complication of DKA. Insulin therapy shifts potassium into cells, worsening hypokalemia. Hyperglycemia, A, is expected but not immediately life-threatening. Mild acidosis, C, is common in DKA. Positive urine ketones, D, confirm DKA but do not require immediate intervention. Question 55. A nurse is caring for a patient with a chest tube following a hemothorax. The nurse notes that there is no drainage in the last hour. What is the nurse's best action? A. Check the tubing for kinks or clots. B. Increase suction on the drainage system. C. Encourage the patient to cough and deep breathe. D. Remove the chest tube and apply an occlusive dressing. Correct answer, A. Rationale: sudden cessation of chest tube drainage may indicate a blockage or clot in the tubing. The nurse should assess for kinks or obstructions first. Increasing suction, B, does not address the cause. Coughing and deep breathing, C, help but do not resolve a blockage. Removing the chest tube, D, is not appropriate unless prescribed. Question 56. A nurse is assessing a postoperative patient who received general anesthesia. The patient is difficult to arouse, has a respiratory rate of 8 breaths per minute, and oxygen saturation of 85%. What is the nurse's priority action? A. Administer naloxone as prescribed. B. Perform a sternal rub to stimulate the patient. C. Increase the IV fluid rate. D. Place the patient in a side-lying position. Correct answer, A. Rationale: the patient is experiencing opioid-induced respiratory depression following anesthesia. Naloxone reverses the effects. Sternal rub, B, is not a treatment. IV fluids, C, do not address respiratory depression. Side-lying position, D, helps prevent aspiration but does not correct the respiratory failure. Question 57. A patient receiving total parenteral nutrition, TPN, has a blood glucose level of 45 mg per deciliter. What is the nurse's priority intervention? A. Stop the TPN infusion immediately. B. Administer IV dextrose as prescribed. C. Recheck the blood glucose in 30 minutes. D. Increase the TPN infusion rate. Correct answer, B. Rationale: hypoglycemia is a critical risk with TPN if the infusion is interrupted or glucose metabolism changes. IV dextrose is the priority intervention. Stopping TPN, A, without dextrose replacement worsens hypoglycemia. Rechecking glucose, C, delays treatment. Increasing TPN, D, is inappropriate. Question 58. A nurse is assessing a patient who received an epidural during labor. The patient's blood pressure is 82/48 mm of mercury, and she reports feeling dizzy. What is the nurse's priority action? A. Place the patient in Trendelenburg position. B. Increase IV fluid rate as prescribed. C. Administer ephedrine as prescribed. D. Turn off the epidural infusion. Correct answer, B. Rationale: hypotension is a common side effect of epidural anesthesia. Increasing IV fluids helps restore blood pressure. Trendelenburg position, A, is not recommended due to risk of respiratory compromise. Ephedrine, C, is used if fluids are ineffective. Turning off the epidural, D, is not necessary unless hypotension persists. Question 59. A nurse is teaching a patient with a new ileostomy about diet modifications. Which statement by the patient indicates a need for further teaching? A. I should drink at least 2 to 3 liters of fluid daily. B. I need to avoid high-fiber foods like popcorn and nuts. C. I should expect my stool to be liquid and frequent. D. I can take a laxative if I don't have a bowel movement for a day. Correct answer, D. Rationale: laxatives should be avoided in ileostomy patients because they can lead to severe dehydration and electrolyte imbalances. Hydration, A, is crucial. Avoiding high-fiber foods, B, prevents obstruction. Frequent liquid stools, C, are expected. Question 60. A nurse is monitoring a patient receiving a blood transfusion. 10 minutes after the transfusion begins, the patient develops chills, fever, and flank pain. What is the nurse's priority action? A. Slow the transfusion rate and monitor the patient. B. Administer acetaminophen for fever. C. Stop the transfusion immediately. D. Flush the IV line with normal saline and continue the transfusion. Correct answer, C. Rationale: the patient is experiencing an acute hemolytic reaction, a medical emergency. The transfusion must be stopped immediately to prevent further hemolysis. Slowing the transfusion, A, or continuing with saline flush, D, would worsen the reaction. Acetaminophen, B, does not treat the underlying cause. Question 61. A nurse is assessing a patient who had a thyroidectomy 24 hours ago. The patient reports tingling around the mouth and fingers, and the nurse notes muscle twitching. What is the nurse's priority action? A. Administer IV calcium gluconate as prescribed. B. Assess the surgical site for signs of infection. C. Encourage increased oral fluid intake. D. Monitor the patient's oxygen saturation. Correct answer, A. Rationale: tingling and muscle twitching indicate hypocalcemia, a complication of thyroidectomy due to parathyroid gland damage. IV calcium gluconate should be administered immediately to prevent tetany and laryngospasm. Infection assessment, B, is important but not the priority. Fluids, C, and oxygen monitoring, D, do not address the cause. Question 62. A nurse is caring for a patient with a new diagnosis of tuberculosis, TB. The patient is placed in airborne isolation. Which nursing intervention is most appropriate? A. Place the patient in a private room with negative pressure. B. Require visitors to wear a standard surgical mask. C. Allow the patient to leave the room with a mask only if afebrile. D. Wear a gown and gloves when entering the patient's room. Correct answer, A. Rationale: airborne precautions require a private room with negative pressure. N95 masks are needed for healthcare workers, not surgical masks. B. Patients must always wear a mask, C, when leaving the room, regardless of fever. Gown and gloves, D, are only required for contact with body fluids. Question 63. A nurse is assessing a patient with a chest tube for a pneumothorax. The nurse notes intermittent bubbling in the water seal chamber. What is the most appropriate nursing action? A. Clamp the chest tube immediately. B. Continue monitoring the patient. C. Increase the suction level. D. Notify the healthcare provider. Correct answer, B. Rationale: intermittent bubbling in the water seal chamber is expected with pneumothorax resolution. Clamping the chest tube, A, can cause a tension pneumothorax. Increasing suction, C, is unnecessary. Notifying the provider, D, is not required unless bubbling becomes continuous, which indicates an air leak. Question 64. A nurse is caring for a patient who reports sudden severe pain in the right calf and has a reddened, swollen, and warm area. What is the nurse's priority action? A. Encourage the patient to ambulate. B. Apply warm compresses to the leg. C. Keep the affected leg elevated and immobile. D. Massage the calf to relieve discomfort. Correct answer, C. Rationale: the patient likely has a deep vein thrombosis, DVT, which can dislodge and cause a pulmonary embolism, PE. Leg elevation and immobility reduce the risk of embolization. Ambulation, A, and massage, D, can dislodge the clot. Warm compresses, B, may be used, but are not the priority. Question 65. A nurse is caring for a patient who is post-op from an open cholecystectomy. The patient reports severe nausea, and the nurse notes absent bowel sounds. What is the nurse's best action? A. Administer an antiemetic as prescribed. B. Encourage the patient to increase oral fluid intake. C. Insert a nasogastric tube, NGT, as prescribed. D. Place the patient in a supine position. Correct answer, C. Rationale: absent bowel sounds and nausea suggest paralytic ileus, a common post-op complication. An NGT to low intermittent suction helps decompress the stomach. Antiemetics, A, do not treat the underlying issue. Fluids, B, should be avoided until bowel sounds return. Supine positioning, D, does not help. Question 66. A nurse is preparing to administer an IV bolus of potassium chloride to a patient with hypokalemia. What is the appropriate nursing action? A. Administer the potassium IV, push over 2 minutes. B. Infuse the potassium at a rate of no more than 10 milliequivalent per hour. C. Mix the potassium chloride in 5% dextrose and water, D5W. D. Assess deep tendon reflexes before administration. Correct answer, B. Rationale: potassium chloride should never be given IV push due to risk of fatal arrhythmias. The maximum safe infusion rate is 10 milliequivalent per hour, B. D5W, C, is not recommended because it can cause insulin release and worsen hypokalemia. Assessing reflexes, D, is unnecessary before administration. Question 67. A patient with chronic kidney disease, CKD, has a serum potassium level of 6.8 milliequivalent per liter. What is the nurse's priority intervention? A. Encourage the patient to eat high-protein foods. B. Administer sodium polystyrene sulfonate as prescribed. C. Withhold the patient's next dose of furosemide. D. Monitor for signs of hypokalemia. Correct answer, B. Rationale: severe hyperkalemia, potassium greater than 6.5 milliequivalent per liter, can cause lethal cardiac arrhythmias. Sodium polystyrene sulfonate, Kxalate, helps eliminate potassium. High-protein foods, A, do not lower potassium. Furosemide, C, is a loop diuretic that reduces potassium, so withholding it is incorrect. Monitoring, D, does not address the immediate issue. Question 68. A nurse is caring for a patient with cirrhosis and ascites who is receiving spironolactone. Which assessment finding requires immediate intervention? A. Serum sodium of 130 milliequivalent per liter. B. Urine output of 500 milliliters in 12 hours. C. Serum potassium of 6.2 milliequivalent per liter. D. Mild peripheral edema. Correct answer, C. Rationale: spironolactone is a potassium-sparing diuretic. Hyperkalemia, potassium greater than 6.0 milliequivalent per liter, is life-threatening and requires immediate intervention. Mild hyponatremia, A, is common in cirrhosis. Urine output, B, and edema, D, are expected findings. Question 69. A nurse is assessing a patient with severe sepsis. Which finding requires immediate action? A. Blood pressure of 88/56 millimeters of mercury. B. Temperature of 101.2 degrees Fahrenheit, 38.4 degrees Celsius. C. White blood cell count of 14,000. D. Blood glucose of 150 milligrams per deciliter. Correct answer, A. Rationale: hypotension in sepsis indicates progression to septic shock, requiring immediate intervention, IV fluids, vasopressors. Fever, B, and elevated WBC, C, are expected in sepsis. Mild hyperglycemia, D, is common in stress responses, but not critical. Question 70. A patient receiving total parenteral nutrition, TPN, suddenly develops confusion, diaphoresis, and tremors. What is the nurse's priority action? A. Stop the TPN infusion immediately. B. Administer IV dextrose as prescribed. C. Recheck the patient's blood glucose in 30 minutes. D. Encourage the patient to drink orange juice. Correct answer, B. Rationale: sudden confusion, diaphoresis, and tremors suggest hypoglycemia, a common TPN complication. IV dextrose is required immediately. Stopping TPN, A, can worsen hypoglycemia. Rechecking glucose, C, delays treatment. Oral intake, D, is not appropriate for NPO patients on TPN. Question 71. A nurse is caring for a patient with acute pancreatitis who suddenly develops dyspnea, oxygen saturation of 88%, and diminished breath sounds in the left lower lung field. What is the nurse's priority action? A. Perform incentive spirometry. B. Notify the provider and prepare for a chest X-ray. C. Increase the oxygen flow rate. D. Place the patient in a high Fowler's position. Correct answer, B. Rationale: patients with acute pancreatitis are at risk for pleural effusion or acute respiratory distress syndrome, ARDS. Diminished breath sounds and hypoxia suggest a pleural effusion. A chest X-ray confirms the diagnosis. Incentive spirometry, A, is important but not the priority. Increasing oxygen, C, supports breathing but does not treat the cause. High Fowler's position, D, can help but is not the immediate intervention. Question 72. A patient who had a hip replacement 24 hours ago reports sudden shortness of breath and chest pain. The nurse notes tachycardia and a respiratory rate of 30 breaths per minute. What is the nurse's priority action? A. Administer oxygen via non-rebreather mask. B. Encourage deep breathing and coughing. C. Apply antiembolism stockings. D. Administer PRN pain medication. Correct answer, A. Rationale: sudden dyspnea, chest pain, and tachycardia post-operatively suggest a pulmonary embolism, PE, a life-threatening complication. Administering oxygen is the first priority while notifying the provider. Deep breathing, B, does not address PE. Stockings, C, prevent DVT but do not treat an embolism. Pain medication, D, does not resolve the respiratory emergency. Question 73. A nurse is assessing a patient with liver cirrhosis who has new-onset confusion, asterixis, flapping tremors, and lethargy. Which laboratory finding does the nurse anticipate? A. Elevated ammonia levels. B. Increased serum albumin. C. Decreased bilirubin levels. D. Low prothrombin time, PT. Correct answer, A. Rationale: new confusion and asterixis indicate hepatic encephalopathy, commonly caused by elevated ammonia levels. Albumin, B, is decreased, not increased. Bilirubin, C, is elevated, not decreased, in liver disease. PT, D, is prolonged, not low. Question 74. A patient with a tracheostomy has thick secretions and difficulty clearing them despite adequate hydration and humidified oxygen. What is the nurse's best action? A. Perform deep suctioning. B. Increase the oxygen flow rate. C. Encourage frequent coughing. D. Administer nebulized normal saline. Correct answer, D. Rationale: nebulized normal saline helps thin secretions, making them easier to clear. Deep suctioning, A, should be a last resort due to airway trauma risk. Increasing oxygen, B, does not help with thick secretions. Coughing, C, is encouraged but may not be enough. Question 75. A nurse is caring for a patient with increased intracranial pressure, ICP, after a traumatic brain injury. Which intervention is most important? A. Maintain the head of the bed at 30 degrees. B. Encourage frequent coughing and deep breathing. C. Perform passive range of motion exercises every hour. D. Administer IV fluids rapidly to maintain blood pressure. Correct answer, A. Rationale: positioning the head of the bed at 30 degrees helps reduce ICP by promoting venous drainage. Coughing, B, increases ICP. Frequent movement, C, is not a priority. Rapid IV fluids, D, can worsen cerebral edema.